name is Sujan, and I'll be a nurse practitioner today.
Okay.
Okay. What we'll be doing is we'll be doing your lung exam today. But before we do that, I want to get your consent. So I'm gonna record this and upload it in the YouTube for my instructor to view. I'm also gonna ask your legal guardian for the consent, if that's okay to upload in the YouTube video, record it, and submit it for educational purposes.
Yeah, okay.
All right. So I have the consent from mother, who is legal guardian for Usan. My patient. I will ask. Tell me your name, please.
Ushan.
All right. What's your date of birth?
June 29, 2012.
All right. Perfect. So we'll be doing your lung exam today. Okay. So if you don't mind, if you can you take your shirt off and put it to the side. All right. Thank you. Okay, we'll just put it over there. First, I will be checking for the. I'll be inspecting the chest wall, the anterior and posterior thorax. I'm looking for the symmetry. I'm looking for the rise and fall of the chest with inspiration and expiration. I'm looking at the respiratory rate, which is normal, between 12 to 20 per minute. I'm also looking to see if any accessory muscles are used for respiration, if there is labored breathing, or if patient is having any difficulty breathing, which I do not see. I'm also looking at the anterior posterior AP diameter versus the transverse diameter, which should normally be 2:1, and which patient has, which is a normal finding. I'm also looking at the color. I'm looking at if there's any changes in the color. I'm looking at any cyanosis or clubbing. Looking at the cyanosis around lips, which I do not see. I don't see any clubbing. The skin is appropriate for ethnicity. After my inspection, also I would inspect on the posterior side to see if there are any deformities, gross deformities, any uneven rise and fall with inspiration and expiration. After my inspection, I am going to palpate. With palpation, can you put your leg straight? There you go. For palpation, I am going to do the respiratory excursion. I'm trying to see if the lungs expand equally. So what we'll do is put my hands around, and so we'll do the anterior part first, and grab, immediately grab a little bit of skin tissue here, and have Ushan deep breath. There you go. Take a deep breath, and I see there's a symmetrical expansion when patient is taking deep breath. Similarly, I will do the same thing on the back side. If you can just twist a little bit. There you go. That's good enough. All right, that's good enough. And I would put my fingers around the lungs, immediately grab some skin tissue, and have patient take a deep breath and see, visualize the expansion, which is equal. All right, you can turn this side now. Okay. And now I'm going to check for the tactile fremitus, and have my patient say 99 as I put my the ball of my hand, the ulnar aspect of it. Can you say 99?
99, 99, 99, 99.
Okay, when I'm doing this, I'm comparing from side to side, and feeling for that vibration in my hand. I will do the same thing on the posterior side, posterior thorax. Can you say 99?
99, 99, 99, 99.
As I'm doing this,
99.
I'm also comparing from one side to another, which I feel vibrates equally on both sides, anterior and posterior. With palpation, I'm also going to palpate and palpate for the skin. I'm looking for if there's any tenderness in the costochondral area or anywhere in the region of the thorax. After my palpation, I am going to percuss. So the percussion, we will percuss on both anterior and posterior aspect of the thoracic area. To percuss, I am going to percuss on both sides and compare from one side to another. So the expected finding would be hearing tympanic sounds. So I would use my non-dominant hand, put my middle finger, use my dominant hand middle finger to tap twice between intercostal spaces. Can you see that? And I'm gonna continue doing this until I hear a dull sound. Okay, so I can feel the tympanic sounds throughout the lung fields in both sides. If you can twist a little bit towards the camera, facing your back towards the camera, we're gonna do percussion. Same thing is starting from way up top on the posterior lungs and comparing side to side until you hear the dull sound. Again, it's tympanic sounds, and you do not hear any dull sound within the lung fields. We can also do a percussion laterally to find for resonance or dull sounds on both sides. Another part of palpation, percussion, would be percussing the diaphragmatic excursion, which is basically the movement of diaphragm with inspiration and expiration. So we will do that diaphragmatic excursion here. So I will have Usan take a deep breath and hold it. And I am percussing until I hear the dull sound, which is right about here. I will mark this space and we'll do the same thing on this side and mark this space. Alright, breathe out, take a normal deep breath, out, normal breath, exhale completely and hold. Alright, now I'm going to percuss until I hear the tympanic sound, which I can hear it right here. We'll do the same thing. Going here, I can hear it right here. So with my markings from earlier, now I'll mark up here and get that distance, which is about 4 to 5 centimeters, is an expected finding with the diaphragmatic excursion. Now, while patient is facing backwards, I'm going to quickly auscultate on the back, and I will have Ushan take deep breaths in and out, and I will start from up top and compare to one side to another. Deep breaths in and out. And I'll do that in a ladder fashion. In and out. In and out. Alright, that's auscultation of the posterior lung fields. And I do not hear any adventitious sounds. I don't hear any wheezing, any rhonchi, any crackles or friction rubs. Lung sounds are clear in all fields, and I hear vesicular sounds. Alright, now we will do auscultation of the frontal anterior portion of the lungs. I will have Ushan take deep breaths again. In and out. Again, the anterior portion, anterior lung fields are also clear without any adventitious lung sounds. We're going to do, there are a few special tests that we can do for the lung exam. Bronchophony, whispered pectorally Q. For this exam, we're going to do a bronchophony test. So I am going to have Ushan, while I listen to my stethoscope, I'm going to have Ushan say 99.
99, 99, 99, 99, 99, 99, 99, 99.
So this is bronchophony test. So with my stethoscope, I was listening, and the expected finding was muffled 99 sound, which was muffled in all lung fields of my patient. If the sound was clear and distinct in 99, that would mean there was some kind of consolidation. With that, I believe our lung exam is concluded. Thank you, Usan, for being part of the exam. Alright, and we'll see you next video. Okay. Thank you.